I am Dr.Senthil Murugan, Maxillo Facial Surgeon, who does a lot of reconstructive work on the maxillofacial region. This center is called Dwijan Dental Research Institute and Virtual Education. Dwijan signifies that Dvi means synonymously known as second, and Jan is Janma, which means birth, the second birth. That is the synonym for this center. So what we usually do, what are the common things we execute in this center is, we undertake a lot of research projects. We are doing research on stem cells, bone morphogenetic protein and bioengineering work. Apart from that, we train the students, those who have finished maxillofacial surgery, in the field of reconstruction using microvascular surgery. The microvascular surgery is, the program is a 10 days program, in which 3 days we have a flap dissection course in one of the reputed centers in Chennai, India. The rest is 7 days. We deal with various types of anastomosis using dry lab as well as wet animal lab, and depends upon the availability of the cases. We take the students for seeing the live surgical procedures in the operation theatre setup. This microvascular surgery center, as we all know, it's a process of harvesting the flap from various distant sites like fibula, radial forearm, anterolateral thigh, rectus abdominis, latus abdominis, scapula, along with the blood vessels, and that is transferred to the site where the deficiency is there, especially in the maxillofacial region. And with the aid of microscopes, we do the anastomosis with various types of suturing techniques, and what are the recent advancements in the field of anastomosis. For example, using the couplers, microstaplers, fibrin glues, and our own product Dwijan staplers and Dwijan tapes, which is as good as your cellophane tape, which doesn't require much of time for doing the anastomosis. These are the process which are being taught for the students, those who come for training program in our center. And talking about the faculty members, those who are visiting the center to train the students, we are very delighted to inform and declare that Dr. Elena Klina from USA, where she is the Associate Director of Microsurgery Research, and IMSS, which is International Micro Stimulation Surgery, Dr. Payani Jayaraman, who belongs to the Dr. MGR Medical University of Chennai, who is an orthopedic surgeon, Dr. Vishnu, who is the plastic and reconstructive surgeon, and Dr. Reena Baby John is a senior most professor who is from Vinayaka Missions University, and myself is a maxillofacial surgeon, Dr. Lalita Subramanian from University of Michigan. These are all our renowned faculties. Apart from that, conducting various anesthesia classes in par with microvascular surgery. Dr. Durai comes from UK, who is there in the Cardiff University. These are the various eminent faculties who visit these places at least once in a year, sometimes individually or sometimes all together, depends upon the module of the courses. This 10 days courses will definitely enrich the students' aspirations to execute all the procedures which has been taught in this center. So far we have conducted 9 batches. 9 batches have come out from this institute in the 5-year span of time, in which they were allowed to do a hands-on training, in which they did the flap harvesting as well as with the anastomosis using various models. And the advantage of this center is there is one-to-one interaction with the faculty as well as with the student, as the participants is maximum limited to 10, and sometimes 5 also we take, in which the students will have an opportunity to discuss with the faculties, various faculties who periodically deals with microvascular procedures, and we have a separate lecture classes in between, so that we can have a interaction with the students from the theoretical point of view, and identification of complications in early stage and addressing those complications while doing the procedures in case of microvascular surgeries. Period of conducting this 10 days workshop is, first, as I said, first 3 days only for flap harvesting, including the theoretical lectures, and the students are the trainees, the aspirants are allowed to do a flap harvesting on the cadaver and simulated mannequins, and the rest of the 7 days they are allowed to do a hands-on training on anastomosis with various techniques like microsutures, microstaplers, couplers and patches and fibrin glue and fibrin reinforced patches. These are all the courses which are being taught for the students. Coming to the post-operative care of the patients, we undertake students for attending the operation theatre in which the surgeries are done. The students are allowed to assist the surgeon who does that procedure, and they are allowed to look after the post-operative care once the surgery is over, so that they can monitor various types of flap assessment, and they can learn that also. Starting from investigations, planning for the microvessel surgery, selecting the cases and training the students, patients, starting with the animals and patients together. At the end of the session, the trainee, the aspirant will go with the full-fledged skill and confidence so that they can execute directly on the patients. Thank you.